Dear audience, welcome to the show Power Chat. In today's episode, we are discussing about alternative medicine and naturopathy. Joining us today is Dr. Sunil Paudel, first naturopath and chronic pain specialist of Nepal. Please allow me to welcome him. Welcome to the show, Dr. Paudel.
Thank you.
How have you been?
Fine, thank you. You?
Well, you have been into the practice of alternative medicine, yoga and naturopathy for a long time.
Yeah, indeed.
As such, you are considered the first naturopath and chronic pain specialist of Nepal.
Yeah, incidentally.
How
yes.
do you see the scope and how do you define the term alternative medicine in the context of Nepal?
I would prefer complementary and alternative medicine. There is nothing called alternative if we talk about health. Allopathic medicine, let's say the conventional modern medicine, none of the naturopath, neither Ayurvedic system or any other systems can work as alternative to each other. But they can work in synchronous, very much in dilution with each other, helping each other. That's what we call complementary. One pathy can complement the other. It cannot work as alternative. Let's take for an example, there is road traffic accident and there is a trauma case. What would I do? If I was alternative, I would have done something. But this is not the case. So I would not prefer to use this term alternative. I would prefer to use complementary. But in today's context, what is necessary is integrative medicine. We need to integrate everything under one umbrella. That's what we are trying to do. Our organization is the first organization in Nepal giving such facilities, where modern medicine as well as acupuncturists, massage therapists, naturopath, yoga experts, all doctors, all are working under the same roof. And this is the revolution. And let me tell you flatly that nowadays people are dying out of non-communicable diseases. People are not dying out of AIDS, tuberculosis or any communicable diseases. Communicable diseases are almost controlled, right? It can be managed easily. There are outbreaks, but now you can see non-communicable diseases like hypertension, cholesterol problems, what we call dyslipidemia, bone and joint problems, stroke, cancers, thyroid problems. These are skyrocketing. So this is what we call pandemic. Forget about coronavirus. This is pandemic. 1 in every 2 person is suffering from NCDs, non-communicable diseases. And what the world has done? Nothing.
Well, Dr. Paudel, you opened with very interesting fact that this is complementary.
Yeah.
And we require some integrated approach.
Absolutely.
Dealing with the diseases.
Yeah.
But where is, say, alternative or in your words, complementary medicine in terms of its recognition?
Yeah. Are you talking about Nepal or?
Yes, in Nepal.
Let's talk Nepal in context of the world. Okay, I would like to give example of India. India is cashing on this, though this Himalayan belt is the origin of yoga and naturopathic medicine, but India is cashing on it. So now Indian government has constituted 2 government bodies. One is Ministry of Ayush. Ayush used to be a department of health. Now it is a separate ministry. Ayush means Ayurveda, yoga, naturopathy, and all these alternative, what you call alternative complementary systems. So Ayush ministry has given lots of backing, and they have been pushing this not only for health, also for the tourism. Because wellness industry, this ministry is handling the wellness industry. Wellness industry currently, right now in 2020, is more than $7 trillion industry. And India is cashing on it out of Ayush ministry. And there is another central agency in India that's called CCRYN, Central Council for Research in Yoga and Naturopathy.
Any initiatives in Nepal that of the similar types in India?
No, not at all. Not at all. We've been trying, but people are just, these politicians, they would love to go and do treatment in India rather than doing something over here. We have got tremendous potential. Our country has got tremendous potential because the herbs, what we get over here, the area, the nature, We are close to nature than any other country. I have been to 22 countries in the world, and I love my country the best. I feel this is the best for such industry. But our government is doing nothing at all.
Why so happening? What are the major reasons behind, not appropriately recognizing or institutionalizing this?
Because of the policymakers. Our policymakers are funded by some other country. You can say the health ministry is funded by somebody else, not by our own country. You know that very well. So all the policymakers, any plan that comes, it is funded by somebody else, usually the pharmaceutical industry. And what they want to do? Pushing medicines, pushing drugs. They don't want to do anything that gives you health naturally. So if we take account of researches, it is proven, even USA, Europe, you can see the modern medicine faculties are taking help of yoga therapy, natural therapy, naturopathy, acupuncture. It's practiced all over. But have you seen any hospitals in Nepal which has got allopathy setup as well as a naturopathy or yogic setup? No. So we are not that modern enough, or we don't know. Maybe our country, the people, the doctors, the policymakers, the politicians, even the bureaucrats, they don't know anything about this field. They know, they don't want to do it.
Well,
because
Dr. Paudel, I will come back to you on the policy issue.
Yeah.
Are you saying that there is no medicine used in the practice of naturopathy or say complementary medicine?
And in yoga and naturopathy, they do teach pharmacology. They do teach pharmaceuticals, but not to use as such as a primary. Sometimes they use for emergency purposes. But
so practitioners like you are not referring any medicines.
Usually I would prefer not to use even one medicine to the patient and cure that person. But in today's context, it might not be that much viable. That's why I am giving you the option of integrative medicine. So we need to integrate. Sometimes in emergency cases, sometimes when things are fatal, we may have to use allopathic medicines, its surgical approaches, its medicines, but later on we can taper off those medicines and make that person live and lead a healthy and productive life without medicine.
What are the areas of our body that someone requires complementary medicine or this treatment?
Absolutely, beautiful question. But let me tell you, this is the only system of medicine that works on all the levels of being. Let's take for an example the definition of health by WHO, World Health Organization. It says health is not merely an absence of disease, but well-being on physical aspect, mental, emotional, social and spiritual. Have you seen any other medicine or medicinal approaches or medicine system that can work on all these 5 aspects? No. Yoga and naturopathy is the only system in the world that works on all the levels of being. I don't mean to say it cures all the diseases. No, that's wrong. But it can work on all the levels of beings. Let's take an example of physical. It normalizes your blood pressure, it calms you down, it keeps you relaxed, it relaxes the muscles, it increases your lung capacity. So it works on all the physical things. So it also works on mental things, because yoga is such a huge science. Now yogic therapy is coming as a new science, that nowadays the part of medicine, what we call neuroendocrinology, it has proven that this works fantastic. Even the institutions like Nimhans in Bangalore are using 9 yoga therapists for what? So it works on the mental being also to balance you emotionally. Nowadays the problem is we react too much for any stimulus, whether it is our personal relations or external. So that is because of the emotional imbalance, and yoga and naturopathy is fantastic in balancing you emotionally as well. Also, yoga and naturopathy, it is not only a system, it is also a system to lead you a healthy life. It's not like for this you don't have to go to a doctor, you just learn from doctors and lead a healthy life. So it regards you as a part of a society, so it helps on social aspect also. And also this is the only system that works on the spiritual aspect.
Well, Dr. Paudel, any studies on the status of the medical naturopathy practitioners like you and other human resources and infrastructure that are required for general public to have access to these treatments?
Yeah, another beautiful question. In Nepal's context, let's talk. We can introduce this without spending even 1 rupee. We have got fantastic government hospitals. We have got huge hospitals, private and government hospitals. What we need is just a room to begin with. Just a room, 12 by 12. That's good enough. A chair for the patient, a desk to write, and a chair for the doctor. We can begin from that. That's the beginning point. What it does what we do there is just counsel the patient, make them feel relaxed, make them believe that to control and manage your disease easily is possible. You can taper off those medicines, you can lead a healthy life and also help your friends and neighbors. It can begin with that. But if we want to talk about huge hospitals, we might need 100 crore or more. But to begin with, we just need a room. For that, we just need a good policy. If we follow that policy, it is very easy to grow from here.
So there is no policy guiding this practice in Nepal at the moment?
Right
or
now,
are there existing instruments that you people are here and practicing this in some context?
In Bikram Sambat 2058 or 59, this was regarded as one of the national systems. 2001, it was regarded as included in Rajpatra as one of the national systems of medicine. That much government has done. In every budget they say we'll develop this field. But what do? They put some funds to some community hospitals or to whomever are near to them. Rather than that, they have not done anything.
What should be done? What are your recommendations?
The first thing what should be done is we need to have our own representation inside Ministry of Health. There should be a body inside Ministry of Health. It can begin from that. We don't have no representation in Ministry of Health. Now whom we are under is under Department of Ayurveda and Alternative Medicine. And we don't have got representation under Ayurveda. So we don't have got representation even in council. We are getting registered in Health Professional Council. We don't have got representation inside ministry, none of the department, none in the council, none in the policy makers. How can we grow this field? And this, let me tell you, is the only field that can be connected and conjoined with the modern medicine to give a better access, more reliable service, to reduce the healthcare cost. This is also a preventive approach also, because if you learn, if I teach my patients, no, you don't have to eat this, please don't eat, do exercise, manage your stress, you can taper down your antihypertensive medicines, or maybe you can cure your dyslipidemia. This is so easy, and lots of researches in modern medicine are showing that heart disease can be reversed. So are we using, who uses an allopath who doesn't have even 5 minutes to talk to the patient? It ought to be a naturopath working alongside the allopathic setup to begin with.
This is really interesting. How do you analyze the situation of higher education in these subjects, alternative medicine or naturopathy? Yoga?
To become a naturopath, you need to study 5.5 years residential medical course under some medical universities. Usually it happens in India. India has got now, I think, 43 such medical colleges. So you need to study first that. And this course is approved by UGC, and it is also approved by the Indian government. And there is high demand all over the world regarding this. But we are not doing anything, we are not cashing on that. It is hard for us to even to keep that human resource in Nepal in our hospital, because there is lucrative business going on outside. He will be called by Deepak Chopra, he will be called by another 7-star resorts, he will be called by the Queen of Morocco. I am talking about some of my colleagues where they have been. So there is high demand all over the world, but in Nepal, we have to struggle. But I am very happy, because I was last week I was in a national conference of medicines of indigenous origin of Nepal. So, and then some doctor from Ayurveda was telling that this all over Nepal there's around 13 lakhs patients in a year. And we had made our statistics in Nepal. We don't have got no government body. We don't have got no government clinic. I'm talking about only those legal centers where legal naturopath who are council registered naturopath and yoga experts are working. We see 5,47,000 patients in a year. So it is a moment of pride that to tell you that we are now half of what Ayurveda is. Ayurveda has got a history of more than 100 years. And in 5 years or 10 years, let's say, we have grown to half of that level. Now this is the right time to invest on us. It is the right time to make policy for us. It is the right time to grow this business. And this is not only for our people, this is also, this can help in the tourism industry as well.
Are there any courses offered within the universities of Nepal?
No, I think Nepal Sanskrit University, they've started, they've just approved the course, BNYS, they've approved in Nepal. Hopefully somebody will start, but because of some policy problems, it might be difficult to start such colleges in Kathmandu. But let's hope. We are
what
working on that.
What is the situation of hospitals and health centers on these issues?
Yeah, the government doesn't have got any policy, so they don't have got even a clinic or any hospitals. But in private, there are I think 35 private hospitals, from 10 bed to 25 beds. And let me tell you, this consists of 510 beds and all the beds are full. Usually all the beds are full, and some hospitals who have taken 25 beds permission, they are having like 50, 60 patients in indoor patients I am talking about. So there people are believing on this and people are coming for this because it's a strong trend. And now it is backed up as a medical science. It's not like some quack or somebody is coming without any medical knowledge. We are taught the same medical course as a MBBS or BMS learns in his medical school. We are under the same university. We are as competent as those people.
Really interesting issues you have brought to the public notice through our program, but there are criticisms about the practice of alternative medicine or complementary medicine, yoga and all in relations to security or safety of the patients, the individuals approaching you people.
Yeah,
okay?
absolutely.
There are some recent incidents in Nepal as well.
Yeah.
You know, how do you ensure that the patients coming to you are secure at a time when, you know, the many categories of the medical practitioners, they are not registered anywhere?
Yeah. Nowadays, all these hospitals I am talking about, the registered hospitals need to have a registered, council registered doctor. So in our even yoga and naturopathy, there are almost 70 council registered doctors. So in these registered, if we talk about any patients, let them go to a registered doctor. Let them ask, what is your degree? If somebody calls, I am a naturopath, please ask them, do you have got BNYS degree? That's the only approved bachelor degree, medical degree in Nepal. They can, there are MDs, there are postgraduate diplomas, there are so many things, but the common people should ask right away, are you a medical graduate? After that, if he says, no, I am a medical grad from such medical institution, then second question he needs to ask is, are you registered in any councils under Nepali law? If this is approved, he cannot do any wrong thing because he has studied 5.5 years in a residential med school and has come and has got a medical registration. That person cannot do anything wrong. I mean, unethical, because we have got our own code of ethics. We work under the code of ethics. So I would prefer anyone going to take such services need to ask whether this is a registered hospital. There are many people who work as a yogi or yoga therapist. They might be illegal. The patient needs to ask. The patient needs to be aware that whether the center is going, is that a registered center? So all these things are going on. And if people go to an illegal quack who doesn't know, have never been to a medical school, then what do you expect? I cannot assure you of the quality of anything if people go to a quack. I can only assure if you go to a registered practitioner, and registered practitioners have got ethical guidelines, they stick to that.
What is the situation of, you know, patients accessing you people.
Yeah.
And what is the result so far? You are here in Nepal for
Yeah.
about 2 decades.
Yeah, almost so.
So how do you observe the practice of alternative medicine in Nepal then and now?
It's going leaps and bounds. I'm very happy with this scene out there. Though I'm very sad to see the government scenario, but in private sector it's going leaps and bounds. We have got now 7 hospitals, small 10-bedded hospitals all over the country. We have got 2 25-bedded hospitals. We are planning to expand that into a health resort and a 100-bedded hospital. I also would like to make one hospital that's free for the people, for needy people. We are working on that. I am very happy seeing that. But we also need research backup. I cannot fund, the center of mine cannot fund a huge research, a multi-center research. We need some funding for research. We need some funding for policy making. Like the government also needs to do something. But people are coming to us with lots of faith. Earlier, like 10 years back, people used to come to me when they are tired of the modern medicine, when they are scared of surgery. Now, right away, they come to me when they have got pain, or they have got some non-communicable disease. They come right to me and they tell, is there any solution or shall I go? This is a good approach. This is what I like. The patient needs to be filtered. There should be a protocol made. If you have got a gastritis, mild gastritis, you don't have to have antacid right away. You don't have to have PPI right away. So what you need to do is whether his lifestyle is okay, whether his food pattern is okay. If we analyze on that, we can start with some herb and with dietary guidelines, he will be okay. So this applies the same thing to other diseases. I am not saying I cure every disease. See, yoga and naturopathy has got no role on trauma and traumatology. We don't have got no role. If there is one trauma or some medical emergency, we don't do it because there is a allopathic medicine does that. So what we do is we handle non-communicable diseases beautifully. We can taper off the medicines. We can make the person understand the cause of disease and address, and we can make that person address his own problems. We can also lead him. We can also lead him to lead a healthy and relaxing life. That's
how do you see the situation of public awareness? You are also a health educator. You go around the different places. Are they aware enough about these all things?
Wherever I go, people call me because they know me already. So they are aware, but not everyone is aware of this medicine. Some people come to me, oh, is this some herbal or Ayurvedic medicine? Some people come to me, oh no, is this something alternative to surgery? So there is some confusion going on. So there is very clear line that this is yoga and naturopathy. Yoga and naturopathy is a multidisciplinary approach. It encompasses all those systems of medicine that have got very limited side effects or after effects. All those natural and holistic medicine we encompass, whether that is massage therapy or acupuncture, or whether that is iridology, many things, hydrotherapy, spa therapies, mud therapies, all these things, it is a conglomerate of many systems of medicines. So we need to make people aware what this is. People don't know, even the policymakers, they don't know what naturopathy and yoga is. They might be thinking we are something like Ramdev. No, we are medical students, we are medical grads. So common people coming, there is huge confusion. But what matters is the result. So we try to give result without medicine, without surgery. That's our primary focus. And for whom? For only non-communicable disease that can be managed. The moment we see something emergency happening, we refer to our fellow colleagues, allopathic colleagues. So
well,
there is
Dr. Paudel, there are many interesting issues, but we are coming to the end of the show. Do you have anything that you have to share to our audience? I have left to ask you very quickly. With any recommendations to the government and stakeholders? Yeah,
the government needs to act very fast. Last week we saw 2 gentlemen dying inside a sauna. Why? Because they were not under medical supervision. So what the government is doing? Sleeping? So the government needs to act fast. And this is happening all over the country. So there are many other fatalities that are to happen. And we are seeing the rise of non-communicable diseases. The new pandemic, every other person has got either high blood pressure or dyslipidemia, what you call increased cholesterol, or heart disease, or diabetes. All these diseases are rising like anything. For that, there is only one solution. The solution is integrative medicine. In integrative medicine, we can go hand on hand with allopathic medicine and help them. So this also decreases the cost the country is spending on healthcare, the country is spending on the equipments, the country is spending on medicines, and there is very least side effects. So I would prefer everyone to follow it. And this is not only a system of medicine, also a system of living. So if you want to learn something, that what your body needs to eat, which kind of exercise your body needs, or which kind of herbs your body needs, we are the right person. You are always welcome.
Well, Dr. Paudel, it was a pleasure talking to you. Thank you very much for your time.
My pleasure, sir.
Dear audience, time now to wrap up the show. Keep watching us. See you next week. Namaste.